Hello and welcome to all. I hope I am audible to you clearly. So I'll just wait for a few seconds for your response to come. Okay, so I'm audible to you now, right? So we are going to discuss this clinical neurophysiology, right? So this is the part 3. Basically we have discussed two part, and if you have not attended this two part, then I am providing you a link so that you can click on that link and you can listen the previous part 2 also, right? So just student, give me a nod whether I am audible to you or not. I am audible and visible to you now. Just give me a thumbs up. Right, okay. So now great. So now we have discussed the part 1 and part 2 of neurophysiology, and I have given the link in Unacademy learner platform also when I was taking the special classes, and here also I have put this two link for you to listen the previous two classes also, because these are the important MCQs. As you know that nowadays the NEET is changing its pattern. So if the pattern is changed, right, if the questions are more clinical oriented, then they will ask you this kind of question. A long stem will be given, a story may be given in that long stem, and from that story the question will be ultimately a little simple, but it will just kill your time by giving a long stem. So you have to be prepared accordingly, right? So we are going to start these classes. So just to give you these two things, that these are the two links that we have already done. Okay, so this is part 1 and this is the part 2 of the clinical neurophysiology that we have already discussed, right? So please follow these two links, okay, and listen the other two classes on clinical neurophysiology. Along with that, I have given my Telegram group link also. The name of the Telegram group is Physiology Mind, so you can search over there, and this is my profile in Unacademy learner platform, right? Now with this brief introduction, I am directly going into the MCQ. So first question in front of you. So this is the question. Look at the question, and this is a simple question. Try to answer. So a 50-year-old man undergoes a neurological examination that indicate that loss of pain sensation also, temperature sensation also, vibration also, as well as proprioception also. Along with there is weakness in the left arm. So motor weakness is also there. These symptoms could be explained by. So just go through these options, okay? Try to exclude one after another and tell me what will be the probable answer in this question, right? Okay. So what is your probable answer? Okay, so here from this stem, the clue is that there is both sensory as well as motor weakness. There is sensory and motor, both involvement is there. Second thing is that there is loss of dorsal column sensation also, there is loss of dorsal column sensation also, and there is loss of anterolateral spinothalamic tract sensation also. Getting my point? What you have to think of, that there is loss of pain temperature. So pain temperature means that is the anterolateral column sensation is lost, plus there is loss of vibration sense as well as proprioception. So vibration and proprioception is also lost, means dorsal column pathway is also involved. Along with that, sensory involvement is also there, motor involvement is also there. So if there is a tumor on right medial lemniscal pathway, so first of all, lemniscal pathway means it is nothing but the dorsal column sensation will be lost. So if there is involvement of this lemniscal pathway, what is going to happen? The dorsal column sensation is predominantly going to lose. Okay, so it is going to lose the dorsal column sensation. So here this vibration and proprioception loss I can explain with this medial lemniscal pathway involvement, but neither the motor weakness can be explained by this and the pain temperature loss cannot be explained by this medial lemniscal pathway, right? Plus the medial lemniscal pathway, they crosses at the level of medulla. So if it is the right here and there is loss of sensation on the left, so that is true, it is possible, but it cannot explain the all sensory loss like that of pain and temperature, plus it could not explain the weakness of the left arm. So this is not my answer. Now try again. So try again. So what may be the next answer? So this could not be the answer here. Okay, any other try? CABA, Partho, Nitish, Sindhu. Okay, all of you, is there any other try? Okay, just by the go by the process of exclusion. So see the big catch or the big problem in C is that it is the left posterior paracentral gyrus. So this is the exclusion here, right? So C is also not the answer. Okay, so a tumor affecting the left posterior paracentral gyrus. So paracentral gyrus involvement, you are absolutely correct that if there is involvement of the paracentral gyrus, it can explain all of these symptoms, but there is involvement of the left. So we know that all the fibers, sensory fiber, they crossed over below the level of the cortex. So if it is right posterior paracentral gyrus, then it will be my answer. But this left here is not correct. Okay, because all of you know that sensory fiber, they crosses below the level of cortex. So if there is involvement of the left posterior paracentral gyrus, there will be involvement of right sided part of the body, but here in the question it is given left arm, so it also cannot be the answer. Third, D, a large tumor in the right lumbar ventrolateral spinal cord. It will not also explain the symptoms, because here the involvement is the left arm region. Here the involvement is the left arm region. So what is remaining? Remaining is only and only peripheral neuropathy. So peripheral neuropathy, motor symptoms can also occur, sensory symptoms can also occur depending on the involvement. If it is a mixed type of neuropathy, then it will involve both the motor symptoms as well as sensory symptoms. And if there is involvement of the peripheral nerve, then all of your sensation, both this pain, temperature, vibration and proprioception, all can be lost from here. Okay, so please remember the answer here is the peripheral neuropathy. I have taken this question directly from Genome. Okay, so in the recent edition of Genome, they have given very nice clinical question, although they are little bit difficult, but they have given very nice question there. Okay, so please remember this question is directly taken from Genome, and the answer here is the B, or peripheral neuropathy. Okay, but if here the weakness is not there, suppose motor symptoms is not given, right, and if it is on the right, if it is rather than left, if it is right, then it will be the best answer. So what I told, suppose in this question this weakness symptoms is not there, only sensory involvement, right, and it is given right, then that will be the best answer, that a tumor affecting the right posterior paracentral gyrus can also explain this kind of loss of pain, temperature, vibration as well as proprioception. But whenever there is involvement of both sensory and motor, it's mainly indicating that the peripheral nerve is damaged. Peripheral neuropathy is the probable problem. Got it, everybody? So this was the first question. Okay, so if you have time, I will say that recent edition of Genome, if you have soft copy, well and good, otherwise I have shared the soft copy in my Facebook group, so you can download the 26th edition soft copy and you can get the answer from there. When is answer D? Option D, here is the lumbar ventrolateral spinal cord. So it is the ventrolateral spinal cord. Ventrolateral means it will only affect the pain, temperature, crude touch, pressure, pain, temperature, crude touch and pressure. It is not going to affect the vibration or posterior column sensation, right? Here all of the posterior column sensation is also lost, as well as the anterolateral. So if the peripheral sensory nerve is involved, then all of this sensation which is carried to the spinal cord, they are going to be affected. Yes, so this is the ventrolateral spinal cord. Okay, ventrolateral spinothalamic tract is involved here, right? So that's why it's not also the answer here, right? Okay. Now next question. Again, this is a simple question, but please read the question carefully and try to answer. What is your answer? This is very simple. This is very simple. Okay, so in a patellar tendon reflex, which of the following items will synapse directly on alpha motor neuron that innervate the muscle being stretched? So question stem is long. You have to read it carefully and then choose the answer, right? What they are asking about. So I'm waiting for your answer. Dr. Shidhu, Dr. Partho, Nitish, okay, Jivan is also there, Harish is also there, right? Nitish is also there, Nitish, okay. So try to choose your answer from here. So this is simple question. So the question is not directly saying that what reflex this is, but they are giving the description of the reflexes and they are asking the question from here, right? Okay. Okay, so more answer. Sidhu, Dr. Vijay has given answer 1A sensory fiber, right? I'll wait for more answer. So this is one of the basic question. Okay, this is one of the basic question in reflex pathway, right? I have got answer from Nitish also. I'll wait for other. Partho, you there? Jivan, you there? Harish? Yes, Partho A also given answer. So Shovik has given D answer, right? Okay, and okay. So Jhansi has given answer 1A. So most of the answer is 1A, and correct answer is also the 1A sensory fiber. So this is basically, it is saying that patellar tendon reflex. Okay, it's not B. So now look at this patellar tendon reflex. So patellar tendon reflex, it's an example of deep tendon reflex. All of you know, and deep tendon reflex is nothing but it's a monosynaptic stretch reflex pathway. So the question is deep tendon reflexes, the question is on stretch reflexes, right? Then second is saying that which one is directly synapting on alpha motor neuron that innervate the muscle being stretched. Mean the muscle which you are stretching, the same muscle is supplied by alpha motor neuron, and which neuron is giving supply to this alpha motor neuron. So if I draw a quick diagram, because next question is also based on this. So suppose this is the muscle which is being stretched. Okay, so this is the muscle, maybe it okay, so patellar tendon reflex. So the question is the patellar tendon reflex. So suppose this is the this is your quadriceps muscle group. So this is my quadriceps muscle group, right? So whenever you are hammering the patellar tendon, okay, whenever you are hammering this patellar tendon, right? So what will happen? There will be stretching of this muscle. Now this stretch will be detected by one sensory receptor which is located inside this muscle, and there is not only one, there are multiple sensory receptors are located like this, and this receptor which is in red color, this is nothing but my muscle spindle. All of you know. So whenever I am hammering this patellar tendon, imagine yourself, whenever you hammering the tendon, you are basically stretching the muscle passively. So if you stretch this muscle passively, what is going to happen? This muscle spindle is also stretched. Now whenever your muscle spindle is stretched, there is one sensory fiber from the center of this muscle spindle, which is nothing but 1A type of fiber, 1A, A alpha variety of fiber. So this 1A fiber will enter into the spinal cord, and this at the level of spinal cord, this 1A fiber is going to make a synapse with the alpha motor neuron of the same muscle. So this is my alpha motor neuron of the same muscle, right? So what will happen? So whenever there is stretching of this muscle spindle, it can detect the length of the muscle, and whenever the stretch is there on muscle spindle, 1A fiber will be active. This active 1A fiber, what it is going to do? It is going to stimulate this alpha motor neuron of the same muscle, and then this alpha motor neuron will stimulate this muscle fiber. These fiber are known as the extrafusal fiber. All of you know this thing. This fiber, this black color fiber, they are known as the extrafusal fiber, and the muscle spindle is composed of fiber which are known as the intrafusal fiber. So alpha motor neuron, from here what I am going to remember? I am going to remember that alpha motor neuron is supplying the extrafusal muscle fiber only, but the sensory fiber or the afferent fiber is only from the intrafusal fiber only. And what is this sensory receptor? This sensory receptor is known as the muscle spindle. So my bottom line is that muscle spindle is composed of, so this muscle spindle is composed of this intrafusal type of fiber. It detects the length of the muscle which is stretched. Okay, so now look at the question once again, that in patellar tendon reflex, which of the following items synapse directly on alpha motor neuron that innervate the muscle being stretched? So alpha motor neuron, the same muscle. Which neuron? That is 1A sensory fiber. 1B sensory fiber, this is from a different neuron. And gamma motor neuron, some of one will answer gamma motor neuron. Gamma motor neuron is a kind of efferent to the muscle spindle. So there is the location of the gamma motor neuron. This gamma motor neuron supply the muscle spindle. It's a kind of efferent. It's a kind of efferent to the muscle spindle. So it is not making a synapse with the alpha motor neuron. Gamma motor neuron is a separate neuron which is located at the level of spinal cord, which is giving supply to the muscle spindle. This is an efferent supply to muscle spindle, right? So these are the few points that I am going to remember from this question, right? So these are the few points that I have to remember, right? All of you correct? So what is your question? It is, sir, why deep tendon reflex is generally monosynaptic? Look at this diagram. How many synapses you are finding out at the level of spinal cord? How many synapses? So this is only one synapse. This is only one synapse between this 1A neuron and this alpha motor neuron. That's why this synapse, this is known as the monosynaptic stretch reflex. Okay, there is only one synapse at the level of center, at the level of central nervous system. So the center for this reflex is nothing but spinal cord. If I look at how many synapses there at the level of spinal cord, then there is only one synapse. That's why this is known as a monosynaptic reflex, right? Okay, so I hope this is clear to all of you. Now I'm going to the next question. So clear now all of you? I'll go back to this diagram once again. Okay, for fast conduction, yes, for fast conduction is also, the reason is there that if there is multiple synapse, then there will be more delay, and this is one of the important reflexes which maintains your posture. So if there is much more delay, then there is a problem. Okay, then there is problem. So like withdrawal reflex, there are multiple synapse reflex pathway, they will take long time. Okay, but here it's a very fast one, right? Now second question, similar question, but look at the question beautifully framed, that a 10-year boy jump off the porch and land on the ball of his feet. The increase in muscle tension, so first clue is here, the increase in muscle tension causes a sudden relaxation of the affected muscle. So many things you have to note down. Okay, so here the increase in tension, okay, but don't only note on the increase in tension. That tension means it's Golgi tendon organ. Don't do like that. Always look at the other things also. Sometimes the increase in tension in the muscle can also causes increase in length of the muscle. But if the question is framed like this, so all of you try to answer this question, then I am coming to the discussion. All of you look at this question and try to answer. What is your answer? Okay, So there is tension and there is relaxation of the affected muscle. I am saying all of these are clue. And yes, Nitish has given answer B, Vijay has given answer B, Savita, okay, Zivan, Nitish, okay, Dr. Jhansi has also given answer. Could you try more? T for tension and T for tendon, okay. So that's why I'm saying that don't always go for the T for tension and T for tendon, okay. You can make mistake in all of them, okay. You can make mistake in all of them. So here the answer is correct, that Golgi tendon organ. So your formula is following the same rule. But suppose I am giving the same type of question and I am saying that there is relaxation of the, just I am changing this word, rather than affected muscle, now I am changing the word antagonist muscle. Now you tell me what will be the answer. Everything is same, okay. I have not even changed the tension also, because tension can sometimes also increases the length of the muscle. There is increase in muscle tension. Tension क्यों increase होगा? Maybe there is stretch of the muscle. So now I am changing this word, that affected muscle, rather than I am changing antagonist muscle. So everything is same. Now it is antagonist muscle. So what is the answer in this question? Getting my point? Why the question become complicated? Okay. So what is the answer in this question? Again the muscles tendon. Okay, so whenever there is relaxation of the affected muscle and whenever there is relaxation of the antagonist muscle, what is the difference? What is the difference? Yes. So now Shovik is 100% correct. Now the answer will be C. Right? So if the question is ditto like this, then they are asking here about inverse stretch reflex. Listen carefully, okay. So if the question is ditto like this, then they are asking about inverse stretch reflex. But if you change this affected muscle to antagonist muscle, then they are asking about a reflex. Yes, answer C. They are asking about reflex, which is known as reciprocal innervation. Innervation, okay, innervation, right? So now look at what is this inverse stretch reflex and what is this reciprocal innervation. So I'll go back to the same diagram, okay. So this is the same diagram that we have already made, right? Okay, now in this diagram I'm just wiping out all of these things so that we can concentrate more on our main part, right? Okay, I hope you have understood all of this, extrafusal, intrafusal, and all of them, right? Okay, so now what I'm doing, there is a receptor present at the level of tendomuscular junction. So Nitish, if the question is where the Golgi tendon organ is located, note down, it is not within the tendon. Golgi tendon organ, most of the cases, they are located in tendomuscular junction, right? So please note down that most of the book will give you the mnemonics T for T. Now if the question is Golgi tendon organ is located in within the tendon, tendomuscular junction, tendon bone junction, then your best answer will be tendon muscle junction. So that's why I have made this diagram here. It is not within the tendon, it is the tendomuscular junction. So first correction is that this is the location of the GTO, Golgi tendon organ, okay. It's also a sensory receptor, but this sensory receptor is particularly dedicated for detecting the tension within the muscle. So this receptor is detecting the tension within the muscle, and it is supplied by 1B type of fiber. But look at 1B fiber is entering into the spinal cord and it is not making synapse directly with this alpha motor neuron. Getting my point? That it is not making a synapse directly with this alpha motor neuron. It is waiting there. And why it is waiting? It is waiting for an inhibitory interneuron to come in between, and this inhibitory interneuron is ultimately going to make a synapse with this alpha motor neuron. So what is happening, if there is increased tension at the level of this Golgi tendon organ, then 1B fiber will be activated. Look carefully. 1B fiber activation means it is going to activate this inhibitory interneuron. Because this interneuron is an inhibitory, what it is going to do, it is ultimately going to inhibit this same alpha motor neuron which is supplying the extrafusal fiber of the same muscle. Extrafusal fiber of the same muscle. So what is happening? Happening is that suppose there is sudden contraction of this muscle. So what I am saying, if there is sudden contraction of this black color muscle, right, all of you are following, suppose there is sudden contraction of this black color muscle. So whenever there is contraction, okay, imagine like this, contraction, contraction. So what will happen, there will be huge amount of tension generated at the level of this tendon. Okay, so sudden contraction means there is increased tension. This increased tension is activating the Golgi tendon organ, and this Golgi tendon organ activation is inhibiting the alpha motor neuron of the same muscle. And if you inhibit the alpha motor neuron of the same muscle, what is going to happen? There will be a relaxation of the same muscle. There will be relaxation of the same muscle. This relaxation of the same muscle, whenever there is sudden contraction of the muscle, this is known as inverse stretch reflex. This is nothing but known as your inverse stretch reflex. Why inverse stretch? Look at the stretch reflex first, then you will understand the inverse stretch reflex. So what I am saying, stretch reflex. So stretch reflex pathway means everybody following. So if there is stretch on this muscle, so this is just opposite. If there is stretch of this muscle, then this 1A fiber is active. 1A fiber active means alpha motor neuron is active. Alpha motor neuron active means the same muscle is going to contract. So what is my definition of stretch reflex? Stretch reflex means if you cause a stretch on the muscle, then it is activating the muscle spindle. Muscle spindle is causing contraction of the same muscle. Muscle spindle is causing contraction of the same muscle. So this is nothing but my stretch reflex, right? But what is happening if there is opposite? So if you are stretching, the muscle is getting contracted, okay, but if there is contraction of the muscle, muscle is getting relaxed. So this is just opposite to stretch reflex, and that's why we are giving the name that sudden contraction means there is increased tension. Increased tension means Golgi tendon organ is active. Golgi tendon organ active means alpha motor neuron is inhibited, and there is relaxation of the same muscle. This is nothing but my inverse stretch reflexes. Getting my point? So this inverse stretch reflex is responsible for releasing the tension on the muscle. Otherwise there will be rupture of the tendon. Otherwise there will be avulsion of the muscle tendon. Suppose you are walking and suddenly there is contraction of this gastrocnemian muscle. The tendon actually may rupture if the tension is not relieved by some reflexes. And that's why this inverse stretch reflex is very, very important for relieving the tension when the muscle tension is very, very high. And that is exactly the same thing which is being asked in this question, that whenever a boy is jumping on his feet, what is happening? There is increased muscle tension. This muscle tension is causing relaxation of the same affected muscle, and this is nothing but which reflex? Inverse stretch reflex, right? But rather than this same affected muscle, if I ask you that whenever you are performing same diagram, now you think of that if you perform the biceps jerk, there is relaxation of the antagonist muscle, है? If you perform the quadriceps jerk, patellar tendon jerk, there will be relaxation of the antagonist muscle. So if you perform stretch reflex, okay, same muscle is contracting, but look at the pathway. There is a branching from this same 1A neuron. this branching is again supplying one inhibitory interneuron. So it is also an inhibitory interneuron, but this inhibitory interneuron is supplying the alpha motor neuron. This inhibitory interneuron is supplying the alpha motor neuron, but this alpha motor neuron is for the antagonist muscle. This is for the antagonist muscle. So this is also my alpha motor neuron. Okay, so this inhibitory interneuron, so whenever you are stretching this muscle, suppose this is my muscle, okay, I have stretched this muscle. If I stretch this muscle, 1A fiber is active. Because of this 1A fiber active, same muscle is going to contract. Along with that, there is stimulation of this inhibitory interneuron. If you stimulate this inhibitory interneuron, it is going to inhibit the alpha motor neuron of the antagonist muscle. So what will happen? The antagonist muscle will go for relaxation. The antagonist muscle will go for relaxation. This pathway is known as reciprocal innervation. This is nothing but reciprocal innervation pathway. Reciprocal innervation was first time described by Serrington's. That's why this is also known as Serrington's law. This is also known as Serrington's law, right? So this is nothing but your Serrington's law. Got my point? So now this, look at the whole diagram once again, you will understand this beautifully. Okay, so now you look at the whole diagram. Okay, so this is the whole pathway. Okay, it is better you could take one images from here and try to learn from book by keeping this diagram in front of you. You will understand better in a simplified manner. Otherwise this pathway is a complex, but I have drawn all of this pathway in a same diagram. Now you tell me whether all of you understood this or not. Reciprocal reflex pathway, this is very simple. Whenever you stretch the muscle, okay, suppose you are performing this biceps jerk, okay, so biceps muscle is stretched. Because of the biceps muscle stretch, the same biceps will contract. That is the stretch reflex pathway. But along with that, triceps muscle will relax. I am asking you, why the triceps is relaxing? The answer is because it is relaxing because of the presence of this inhibitory interneuron, which is also stimulated by same 1A neuron. Okay, and this is nothing but my reciprocal innervation pathway. This is nothing but my reciprocal innervation pathway, right? All of you, everybody, just give me a thumbs up whether you understood this or not, or if it is require repetition, I'll again tell you the same thing, but this is the exact thing. If you listen carefully, or if you don't understand, please go through the video once again, you will understand it. There is no problem. Okay, Haris, very good. Thank you so much. Okay, so this is the pathway you should remember. Okay, just keep this diagram in front of you, many questions will be answered. Okay, so if I ask you that antagonist muscle relaxation, then the pathway is nothing but reciprocal innervation. If it is pathway of reciprocal innervation, so reciprocal innervation, what is the sensory receptor for this reciprocal innervation? Tell me, what is the receptor for this receptor for this reciprocal innervation? So reciprocal innervation is nothing but relaxation of the antagonist muscle. Tell me which sensory receptor is causing this. Okay, which sensory receptor is causing this, right? So this is nothing but 1A is coming from where? Yes, exactly, this is nothing but muscle spindle, right? Very good. So if the question is exactly like this, then this is nothing but inverse stretch reflex. The tendon, Golgi tendon organ is the answer here. But if the question is twisted, okay, and if it is said that antagonist muscle is getting relaxation, then your answer will be this muscle spindle, right? This Pacinian corpuscle cannot produce this kind of reflexes. Free nerve ending, they can causes withdrawal reflex. Whenever there is severe pain, you know that if there is a severe pain in one of the part, okay, suppose there is a nail, okay, which is striking your foot, so you lift your foot from there, that is the withdraw reflex, and that is done by this nociceptor, which is located on the free nerve ending. So free nerve ending is for the withdrawal reflex, but not for the stretch or inward stretch reflex. Okay, so now look at the next question. Okay, so someone was asking that about the nuclear bag and chain fiber. So this is the question. Okay, that's why I keep this question, that it will be always there is some query like this. So try to answer this question, then I'll discuss. Inverse stretch reflex. Okay, so myotactic reflex means this is nothing but stretch reflex only. So here the question is inverse stretch reflex. Everybody read the option carefully and try to give the correct answer. There should not be any mistake here, because we have discussed already. Inverse stretch reflex, it is not reciprocal innervation. Inverse stretch reflex. So please try to answer correctly. Okay, so Nitish has given answer, Sobik has given answer, Siddharth, okay, Jhansi has also given answer. Anybody remaining, do you want to answer? So what is the inverse stretch reflex? Just now we had discussed the inverse stretch reflex and reciprocal innervation, they are separate. Okay, look at the previous one. If it is reciprocal innervation, then the receptor is muscle spindle and 1A is the fiber. But if this is the question, that inverse stretch reflex, what I told earlier, that inverse stretch reflex is nothing but sudden contraction of muscle increases tension, that is activating GTO. GTO is inhibiting the alpha motor neuron. So what is the answer in this question? Answer is nothing but I have to choose the Golgi tendon organ first. So inverse stretch reflex means it is nothing but GTO is the first. Whenever I am saying GTO, then 1B is the fiber which is connected with the GTO. Okay, then this 1B fiber, where they are making synapse, they are making synapse on a inhibitory interneuron, and this inhibitory interneuron is causing relaxation. It is causing relaxation or inhibition of the alpha motor neuron. So answer of this question is nothing but D, D and D. D, D and D. So please look down. Okay, so I hope you require a quick revision. So this is my muscle. Okay, so this is my muscle. You try to answer. If I draw a diagram like this, okay, if I draw a diagram like this, and this is my muscle spindle. Okay, this is my muscle spindle. So from this muscle spindle, 1A fiber is going. This is which reflex pathway I am going to discuss. 1A fiber is going. This is which reflex pathway, and this 1A fiber is making a synapse with the alpha motor neuron. Which reflex pathway this is? Everybody write down your answer. Which reflex pathway this is? Everybody try to answer. If this is the pathway I am drawing, it's a monosynaptic, but what is the name of this reflex pathway? So here the reflex pathway is that if I stretch this muscle, the muscle is going to contract. So if I stretch this muscle, the muscle is going to contract. Yes. So this is nothing but my stretch reflex pathway. Exactly, everybody correct. Now look at, now I am drawing a branching from here. Okay, passive stretch, obviously passive stretch. Now I am drawing a branching from here. This branching is giving supply one inhibitory interneuron, and inhibitory interneuron is inhibiting the alpha motor neuron of the antagonist. Which pathway this is? What is the name of this pathway? It is causing inhibition of the antagonist muscle. This is, what is the name of this connection? What is the name of this pathway? Yes, Siddharth is correct. Yes, Dr. Jhansi, you also try, Dr. Jivan, you try once again, that what is the name of this pathway? Yes, so this is nothing but my reciprocal innervation pathway. So this is nothing but my reciprocal innervation pathway. Everybody, very good. Now I am saying that apart from this, there is a receptor here at the tendomuscular junction. This is GTO. So whenever I am saying that one sensory fiber is originating from this GTO, this is 1B, and this 1B is innervating interneuron. This interneuron is inhibiting the same alpha motor neuron. Which pathway this is? Which pathway this is? So if I follow this pathway, that from Golgi tendon organ 1B is 1B fiber is stimulating here inhibitor interneuron, and that is inhibiting the alpha motor neuron. So there will be relaxation. Which pathway this is? Yes, exactly. So this is nothing but my inverse stretch reflex. So this is nothing but my inverse stretch reflex. Exactly. Very good, very good. Now you got the gist of this reflex pathway. ठीक है ना? अभी ठीक है ना? Now you should not make any mistake here. So now this is, I hope this is clear to all of you. Very, very simplified diagram. You try to draw yourself, okay? One or twice if you draw yourself on a rough paper, na, then you are going to remember the connection in a better way, right? Okay. Okay. So before that, the student who asked about this muscle spindle, okay? So now if I draw one muscle spindle quickly. So if I draw one muscle spindle diagram, write this. Suppose this is my muscle spindle, okay? So what is this? Muscle spindle, right? So this muscle spindle is composed of one bag-like region. So this is a fiber which contain a bag-like region, and it contain multiple nucleus inside this bag. Name of this fiber is nothing but nuclear bag fiber, okay? On the other hand, look at the other fiber. Here there is no bag-like region, but there are multiple nucleus, and these multiple nucleus are present throughout this muscle fiber. These are known as the nuclear chain fiber. So whether it is nuclear bag fiber or whether it is nuclear chain fiber, right? All of them are nothing but which type of fiber? They are nothing but intrafusal kind of fiber, intrafusal fiber, because it's a muscle spindle. Now this nuclear bag fiber, they can be of two types. One is dynamic one and one is a static one, right? Static one. And nuclear chain fiber, they are always static in nature. Now what do you mean by dynamic and static fiber? Dynamic fiber means they detect the change of velocity. They detect the velocity of the muscle fiber, okay? And static fiber, they detect the length of the muscle fiber. They detect the length of the muscle fiber. Static fiber has additional two fiber. Just hold on. So dynamic fiber means if the length is changing with respect to time, that is dynamic. And static means only increase in length. It is not changing length. It's a fixed increase in length. That is the meaning of, okay? Now 1A fiber is connected from all of this type of fiber. So if I ask you 1A fiber, okay, which we have just seen, 1A type of fiber, from where they are connected? They are connected from all type of fiber, okay? They are connected from all type of fiber. So that's why if I draw the diagram, it is connecting the nuclear chain fiber, it is connecting the nuclear bag fiber. This is nothing but 1A fiber. But this 1A fiber is connected at the central region of this muscle spindle, okay? On the other hand, there is type 2 fiber also, which originate from the peripheral part of this muscle spindle. This is type 2 fiber, okay? This is not 1B. 1B is from Golgi tendon organ. This is the muscle spindle we are talking about. This type 2 fiber, they connect only and only static fiber. It may be static bag or it may be static chain. So basically type 2 fiber is connected from static bag as well as static chain. So type 2 fiber means this is nothing but connecting the static fiber, and type 1A means it connects the dynamic one as well as the static one, both. That is the discussion of muscle spindle in brief. Although there are other mechanism also, other fiber are also there, but this is the in brief discussion of the muscle spindle, right? So go through this diagram once again and listen it once again, so you'll understand each and everything about this muscle spindle, okay? Now coming to the next question. Next question is in front of you. Stimulation of the punishment center can inhibit the reward center, demonstrating that fear and punishment can take precedence over pleasure and reward. Okay, so punishment center can inhibit the reward center. Okay, reward center, you know that if you stimulate that center, there is a center in your brain. If you stimulate that center, you will get very kind of happiness in your body. But punishment center means if you stimulate that area, the feeling will be very, very bad, like you are getting some kind of punishment due to some nature. Okay, so this pleasure center and this punishment center. Punishment center is more dominant over this reward center. Now question is very simple. Which center is known as the punishment center? So what is the answer? A, B, C, D. Try first, then I will discuss. Okay. So Sovik has given answer A, right? Sovik has given answer A. Anybody wants to try? Anybody? No? So I hope this anterior hypothalamic nucleus, this is one of the important anterior hypothalamic nucleus. You could recall that there is presence of osmoreceptor in this anterior hypothalamic nucleus, right? This lateral and ventromedial nucleus, okay, they contain the feeding center and satiety center. This kind of center are there. Lateral center is for the center for the thirst and feeding, okay, and ventromedial nucleus is known as the satiety center. Okay, so this is not the answer, right? Okay, and anterior is also for the regulation of the temperature. Okay, so posterior for cold response and anterior for hot response, but I am not going for detail of this because anterior nucleus has many functions. Okay, sexual function is also controlled by anterior nucleus. Okay, supraoptic nucleus, all of you know that this is for the secretion of the hormone ADH, okay, and little amount of oxytocin. So answer in this question is nothing but the periventricular hypothalamus and midbrain central gray area, right? So please remember the answer of this question is B. So now look at this is the thing that you have to remember about this reward center and punishment center. Okay, so reward center means look at where they are main located. Location of the reward center is medial forebrain bundle. This is the main center. If you stimulate this center, then the happiness will be seen in the experimental animal. Scientist has done experiment on monkey. Okay, they put electrode here in this different region, and if they are stimulating this electrode, then the monkey become very, very happy as if he is getting some reward, right? So this is the main center I have to remember. Other center you may or may not remember. So this ventromedial nucleus, although this is responsible for satiety center, little role is also there for the reward center. So that's why this option has been given, that lateral and ventromedial nucleus of hypothalamus, it's not the punishment center, it's the reward center. So what about the punishment center? The most potent punishment center is the central gray area surrounding the aqueduct of Sylvia. So remember this periaqueductal gray matter, that is the main punishment center. Okay, and along with that, it is extending upward into the periventricular zone of hypothalamus and thalamus. So that's why this periventricular zone of hypothalamus is the answer in the above question. So first, if the question is reward center, you go for this medial forebrain bundle. If it is not given, then this lateral and ventromedial nucleus. Punishment center, first you go for this periaqueductal gray matter. If it is not there, then this periventricular zone of hypothalamus is the answer of this question. So this is about reward and punishment center. So that's why in this question our answer is periventricular hypothalamus and medial central gray area. These are the two areas which are punishment center, right? So this is all for today's class. Okay, so I am finishing the session here. I will also discuss the part 4. Okay, part 4 that will be discussed in a next session, probably maybe on Tuesday, maybe on Wednesday. I am not sure about the timing, so that's why I am not announcing here about the timing, because the schedule will be done by the Unacademy people, but the part 4 of this neurophysiology, clinical neurophysiology, will be discussed maybe on Wednesday, maybe on Tuesday, right? But within this month only. Okay, so now this is for your promotion purpose that I am taking this crash course on NEET PG. This will be 24-hour whole physiology will be discussed in this session, followed by there will be an MCQ marathon. Almost all of the MCQs which have been asked previously in NEET examination, I am going to discuss this. So if you planning to join this paid platform, then please use my code, that is Dr. Soumen 10, right? And this 2 session is under the heading of this Operation Neetpg. So not only the physiology, all subject will be discussed in this platform, that Operation Neetpg 2021. So if you are planning to join this course, please use my referral code, that is DRSOUME10. So you can see here that almost the main faculty, top faculty who are there in the Unacademy platform, all of you, all of them are going to teach you in these courses. Okay, so these are the detail about the course structure and the different faculty who are going to teach you in this course. So if you join, so this is the process how to join. I hope all of you know this thing, how to join. So for 1 month this is the price, but 1 month rather than 1 month, the 3 or 6 month package is more cheaper. So this is my code, and these are the free upcoming session. But this upcoming session will be on it is available on your app. Which one? This is not available. So this is the upcoming Neetpg session. Okay, this is on Unacademy Learner platform. Okay, and this is the Neetpg YouTube channel. So please subscribe this channel so that you get notification for different classes which are absolutely free for you, right? So thank you very much. This is all for today. Okay, thank you so much for listening and attending the session, right? So now I am signing out.